I've been seeing Dr. Steiner now since about June of 2023. My laundry list of symptoms started back around 2019, 2020. I was on the phone with my husband on the way here, and I mentioned that, wow, all this started about 6 years ago, which is kind of crazy to think about where I started, where I went to, and where I am now. Just very different. And so, of that laundry list of symptoms, bloating, inflammation, like he mentioned, fatigue was one of my big ones, brain fog. I couldn't hardly remember anything, and I was 23 years old. And I was having to take a nap to get through my work day. I had to quit my job, find a work from home job that would allow me to take a 1 hour lunch break in the middle of the day whenever I needed it, so that way I could plan my 1 hour nap, so that way I could make it through the rest of my day. So after months and months and months of doctor's appointments, countless blood draws, I'm sure some of you, if not all of you, have been there with that, and about 3 different misdiagnoses, I came across my GI who diagnosed me with Crohn's disease. That was about all they had for me. They had a diagnosis and about 6 different prescriptions that they put me on. With all the other doctors that I had seen, I was then up to 8 prescription medications that I was taking. I had morning, middle of the day, evening, before you eat, after you eat. I had reminders going all throughout the day, so that way I could try and remember when I was supposed to take everything. So, I'm sorry, I have my notes so that way I don't go too off track. Fast forward to when I met Dr. Steiner. Like he said, you have about an hour-long appointment, and you go over all of your health history from when you want to start, and you tell him everything that you think could be relevant, and then he asks you questions about things that you don't even realize are relevant. That when he starts asking you those questions, you realize why none of your other doctors have been able to give you answers, because they're not asking the right questions, because they're blowing in for 30 minutes, they're not sitting down with you and asking the right questions, finding the root of the problem, finding out why you're not able to function the way that you were intended to. I grew up as a dancer and a twirler. So I would have about 9 hours of dance classes a week and probably about 5 to 6 hours of practice with my baton twirling. I didn't grow up with a sedentary lifestyle. I grew up with my very depending on my body to be able to do what I needed it to do when I needed it to do it. Having to take a nap halfway through my day to get through an 8-hour workday at 23 years old was not what I signed up for. And there was no reason, especially from what the doctors that I had talked to were able to find. After working through the plan that Dr. Steiner and I put together, he set me up with a nutritionist. I was able to get my nutrition under control, which got the bloating and the inflammation under control, led to getting the brain fog under control. I got my energy back. I got off of all of my prescription medications except for the one that is helping to manage my Crohn's disease. And I work with my GI and Dr. Steiner, and that is what has led me to where I am today. And with all of that said, I can just tell you right now that there is not a doctor out there that I have found in the 6 years that I have been trying to deal with this that is going to take the care in your health that you would put into your health. And that's about all I have to say.
Thank you so much, Haley.
Yep.
How wonderful is that? Haley, how much weight have you lost?
I think last I checked, I was around 53 pounds was what I had lost. And I had gained around 60, so.
Yeah. So she's doing fantastic now, living a great life. She looks fantastic. So thank you so much for coming in, Haley. We greatly appreciate that.
Yeah.